Like all of you, I was hoping the beginning of 2022 would mean the end of COVID. But we start this third year of the pandemic with record numbers of new cases, rising hospitalizations, a cascade of flight cancellations, and strains on essential services. One bright spot, the evidence is mounting that almost all vaccinated Americans, even if they test positive for the Omicron variant, will not become seriously ill. But millions of us are now heading back to work and school after the holiday break with new questions about what's to come. So we welcome back the President's Chief Medical Advisor, Dr. Anthony Fauci. Happy New Year, Dr. Fauci. Thank you for joining us again.
Thank you.
Help us make sense of all this new information coming in on Omicron. What's your key message on where things stand right now?
Well, we are definitely in the middle of a very severe surge and uptick in cases. If you look at the uptick, it is actually almost a vertical increase. We're now at an average of about 400,000 cases per day. Hospitalizations are up. One of the things that we hope for, George, is that this thing will peak after a period of a few weeks and turn around. We've seen that happen in South Africa where they had a major surge, but as quickly as the surge went up, it turned around. We can help that a lot by the things we talk about all along. You know, vaccinations, if you're vaccinated, get boosted, careful and prudent, wearing masks in indoor settings. Those are the kind of things that do help to blunt even a surge as pronounced as the Omicron surge. But there's no doubt about it. The acceleration of cases that we've seen is really unprecedented, gone well beyond anything we've seen before.
It's gone beyond anything we've seen before. That's the transmissibility problem. But what about the evidence that Omicron leads to less serious infection, less serious illness?
Well, there's accumulating evidence, George, that that is the case. We first got inkling of that in South Africa when one looked at the relationship and the ratio between hospitalizations and cases. It was lower. The duration of hospital stay was lower. The requirements for oxygen was lower. We're seeing a bit of that, not as pronounced in the UK, but certainly that trend. And if you look here at the United States, we don't want to get complacent at all, and you don't want to jump to a positive conclusion because it's still early. But given the large number of cases, we have not seen a concomitant increase in the relative percentage of hospitalizations. But again, hospitalizations are often late lagging indicators. But I still believe that there is indication, even in some animal studies that have been done, George, where they did particular animal models that might reflect what's going on. And the virus does seem to have a lower intrinsic pathogenicity to it. We're hoping that's the case. But having said that, George, I want to say one thing. We've got to be careful about that. Because even if you have a less of a percentage of severity, when you have multifold more people getting infected, the net amount is you're still going to get a lot of people that are going to be needing hospitalization. And that's the reason why we're concerned about stressing and straining the hospital system.
That is the huge concern right now. But are we heading to the point where we should be focusing less on the daily caseload?
You know, particularly, the answer is overall yes, George. And this is particularly relevant if you're having an infection that is much more asymptomatic and minimally symptomatic, particularly in people who are vaccinated and boosted. The real bottom line that you want to be concerned about is, are we getting protected by the vaccines from severe disease leading to hospitalization? I'm still very concerned about the tens of millions of people who are not vaccinated at all, because even though many of them are going to get asymptomatic and mildly symptomatic, a fair number of them are going to get severe disease. But in direct answer to your question, as you get further on and the infections become less severe, it is much more relevant to focus on the hospitalizations as opposed to the total number of cases.
Most schools are set to open tomorrow after the holiday break. Are you confident that's the right call?
I believe it is, George. You know, when we've done the balance so many times over the last year, about the deleterious effects of keeping children out of in physical presence in the school. And it's very clear that there are some really serious effects about that. If you look at the safety of children with regard to infection, we have most of the teachers, overwhelming majority of them are vaccinated. We now can vaccinate children from 5 years of age and older. I plead with parents to please seriously consider vaccinating your children, wearing masks in the school setting, doing test to stay approaches when children get infected. I think all of those things put together, it's safe enough to get those kids back to school, balanced against the deleterious effects of keeping them out.
There's a pretty big backlash this week to the CDC cutting quarantine for those who've tested positive without symptoms to 5 days. First of all, are you surprised by that? And why not have a negative test? Why not require a negative test for that extra layer of protection?
Well, let's talk about the first principle, George. The idea of if a person is without symptoms and infected, that they need to be isolated for 5 days. Normally, that would be 10 days. The CDC decided that they would cut that down to 5 days if the person remains asymptomatic, so long as when they do go out in the second 5 days of that 10-day period, back to work or back into society, that they diligently wear a mask. You're right, there has been some concern about why we don't ask people at that 5-day period to get tested. That is something that is now under consideration. The CDC is very well aware that there has been some pushback about that. Looking at it again, there may be an option in that testing could be a part of that. And I think we're going to be hearing more about that in the next day or so from the CDC.
Finally, sir, what's the best piece of news you can give us to start 2022?
Well, the best piece of news, George, is that if we continue, and I hope that people who are now seeing the devastating effects that this virus has done on us with an Omicron surge, that we get more people vaccinated to the point that when Omicron comes down to a low level, we keep it down at a low level enough that it doesn't disrupt our society, our economy, our way of life. That's what I'm hoping for. I hope that as we get into February and March and such, that we will be at that level of control. That's not a prediction, George, because it's dangerous to predict. I'm just telling you what I hope we can do, because I believe we can do it if we do all the things available for us. Again, get vaccinated if you're not vaccinated, and get boosted if you are vaccinated.
Dr. Fauci, thanks as always for your time and your information.
Thank you, George. Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.